Okay, so I'm going to try to do this video without crying. If you're familiar with my videos, you know that I've been a nurse for over 20 years, and I've always been the type of nurse that I don't let a lot of things bother me. I can kind of shut myself off. I can get past the trauma that is happening in front of me and just kind of do my job. But every now and then there are those cases that just really stick with you. And the other day I had one of those cases where they called a rapid response. We got there. It turned into a code, a very long code, and did not have a good outcome. And I wanted to tell this story because it shows that nursing is not just about giving meds and all the procedures and all of the tasks that we do on a daily basis. Sometimes it's just that human connection between patients or family members. So I'm going to be very careful of what I say here because I don't want to break any HIPAA violations or anything like that. But we had a young person who we coded multiple times. The last time that we had coded them, it was a long amount of time, probably longer than we normally would have gone on for. But because of the person's age, we felt the need to just keep trying. So the mother was in the hallway. She was watching the entire time. This went on for, I want to say, 3 hours or more. She was there the entire time in the hallway watching from the doorway because she just wanted to be able to see her child the whole time. And I was at the code cart and I could hear everything she was saying. I was trying to give her updates throughout, and all right, this is going to be the hard part. So she says to one of the doctors who had been standing there with her the whole time and consoling her and walking her through everything, and said, "I just want her to hear my voice." So I overheard her and I just thought, I have to get her at the bedside. I have to get her in the room. So I went in and was talking to one of the providers, and I said, her mom just wants her to hear her voice. Then I turned to the pulmonary fellow who was, helping run everything, and I said, "Listen, is anyone opposed to the mother coming in the room so she could talk to her?" And everyone was in agreement that it was okay, and we would, make some room and kind of clean up as best we could so that it wasn't too traumatizing for her. And I brought her in the room. She started to talk to her, and we had literally been coding her for almost 40 minutes at this point. And I'm not kidding. We never had a pulse the entire 40 minutes. And after she talked to her on the next pulse check, she had a pulse. It sent chills through my body. Because again, it shows that there's more to healthcare and there's more to nursing than just the medical things. Part of being in healthcare is taking care of the person and their family. So I say this to all the new nurses out there, that if you don't know what to do in a code or an emergency situation, sometimes just doing those little things of talking to family members or holding the patient's hand can mean so much. They don't always remember the things that you did for them, but like the Maya Angelou quote, people don't always remember the things that you do or say, but they remember how you made them feel.